I'm Deborah Rivera. I'm a physician associate here at Health Horizons, and I'd like to talk to you today about perimenopause and menopause. I think there's a lot of myths that float around about menopause and what it is and what it isn't. And I found out through my own experience what all it involves. All I had heard about menopause was that you get hot flashes and your period stops. But I found out there's a whole lot more to it than that. In fact, perimenopause is that period of time before menopause actually hits, of about 3 to 10 years where hormone levels are naturally declining. When I talk about hormone levels, I mean more than just our estrogen. It's true, estrogen starts to decline, our body doesn't make as much, and that's why we start getting symptoms. But our testosterone levels also decline as we get older, and that's true for men and women. We always take a good look at thyroid to see if that also needs some attention, because it is a very powerful hormone that does over 200 different things in the body. It is a complex combination of symptoms that we end up with. Hot flashes is one of them, and that can be in the day or it can be at night, known as night sweats. It can be moodiness, like anxiety or depression, and irritability. Sleeping at night, something we used to take for granted, now becomes a problem. Feeling tired, gaining weight, especially right around the middle, not a fun place to have it. We may start getting a little facial hair, which nobody likes. Brain fog, just trouble remembering names or recalling a word you're trying to say. Joint pain can become more prominent. And we tend to get a very low libido, or sex drive sometimes is just gone, and we can't figure out why. It's a very complex combination of symptoms that we feel. Oftentimes when I first meet women, they come in complaining that they're ready to either divorce their husband or kill him. We can laugh at it later when she realizes that he's actually a pretty good guy, which is why she married him in the first place. Those mood changes really affect us and our families. Those people that are closest to us really notice, and we get tired and not wanting to do things like we used to. We all have a big list of chores to do when we get home from work. House cleaning and shopping and taking care of children, and there's a lot to do, and sometimes we just don't feel like doing it. Then we end up taking a back seat to our own health, not exercising as we should, not spending as much time planning and preparing meals, and just doing fun things with our families and friends to enjoy life, relieve stress. It really impacts us, and that just compounds on itself, all that stress. It's time to take a good look and take care of ourselves, and that can help us feel better. Then we're ready to help take care of the rest of the family, and that really is helpful. When somebody comes in for the first time, we usually start by ordering labs. We want to get a good idea of where their hormone levels are at. We customize a plan just for them, depending on where their levels are at and also what their preferences are. Here at Health Horizons, we use a plant-based bioidentical hormone. It is a safe option for hormone replacement. It doesn't increase our risk of cancer or other side effects, such as heart disease, and is safe for us to use, and it's effective to relieve symptoms. We can do it in different ways. We can use a troche, which is a strange word, but a troche is a little lozenge that you suck on twice a day. It goes into the mouth and is absorbed by the blood vessels that are in the mouth, and it works beautifully. We also like to do pellets, literally little pellets of hormone that are inserted in the upper bottom, under the skin in the fatty part. They work beautifully to give a nice steady flow of hormone for 3 months for women or 6 months for men. So another great option and a safe option. I remember when I started feeling symptoms, that perimenopausal stage, and was at the drugstore looking for all kinds of herbal remedies and things that could help. If I knew then what I know now, I would gladly take a blood test to find out where I'm at and see what kind of help I could get, even at this stage. There are lots of things we can do for hormone replacement even before we hit full menopause. And we can do lots of different things to help with that. Then when menopause does hit, again, we help out, adjust the hormones that's in the treatment and help people get right through menopause. Things we talk about in an initial visit and subsequent visits with patients, besides just hormone, is healthy living. Our goal is to be healthy, active people who can enjoy life and remain that way through our golden years. And we talk a lot about stress relief. We have a nice cardiac screening test that helps us look at our stress levels, both physically and mentally. We talk about healthy eating and how to avoid the traps that the American diet falls into every day so that we can stay a healthy weight and we help keep a healthy heart and stay looking good throughout the whole process. So those kind of things I think are really important. And we can't forget the men in our lives. Men go through andropause, which we lovingly call menopause, because their symptoms are very similar to what women go through. Men's testosterone levels naturally decline as they get older. As they get lower and lower, they become more and more symptomatic. Eventually, they get to a point where they're miserable enough where they'll finally come in, or their wife makes them come in. And we test their levels. Sure enough, they're low. Men, when we finally get them on testosterone therapy, love their testosterone. It helps them feel so much better, and they do really well on the treatment. They have the same kinds of options of troches and pellets and other methods, and do really well with that. We talk to them about eating healthy and staying active, stress relief, all those kinds of things, just like women.